the Department of Public Health and Social Services, Annette Aguon, who's the man. Annette, you got like a 5 foot long title, but I just like to keep it simple and say you're the boss of the contact tracing. That's accurate, right?
Yes, sir.
Okay. Good morning.
Good morning. Half a day.
First of all, let's give Annette a big round of applause because it's so last minute. She was able to jump on the show. Thank you, Annette, for getting to work a little bit early and doing the Zoom thing. You got to look at that desk. That is the sign of a hard worker, right? And is that all the contact tracing that's ongoing behind you, or those the files?
No, sir. That's all the other work public health still has to do.
Oh, wow.
All right, so let's just get right into it, Annette. We wanted to get you on to talk about the status of the different investigations that you guys are doing. So can we just go ahead? We'll give you the floor and just give us your sit rep.
Well, we continue to test individuals through our quarantine facility. As was announced last July 24th, we had some changes to our mandatory quarantine protocols. And so there's been some shift in regards to low risk areas and non-low risk areas, and kind of giving flexibility in individuals who were able to receive testing prior to their arrival on Guam, as well as the ability if they're able to go to self or home quarantine, or whether they need to go to the government facility to quarantine for the recommended time. We're allowing for testing out. And again, this is based on information and guidance provided from our physicians advisory group and their recommendation that we have updated and revised our mandatory quarantine protocols. And again, we definitely don't want to have individuals stay in quarantine for a long period of time. However, our main goal is to definitely protect our island and our people of Guam from any importation of diseases. As we know, there's a resurgence throughout numerous states in the mainland. We are concerned and monitoring our neighboring countries in the region. And again, we have not beat back this virus, and so we continue to do our surveillance, our testing, our monitoring. Yes, sir.
Go ahead.
No, and then so we've been fortunate, if you want to look at it on the positive light, that through our testing of individuals in quarantine, that we've actually identified new positive cases, and so that they've been appropriately moved to the isolation facility. And so in that aspect, we continue to protect our borders from any importation of diseases. Of course, there are those challenges where people are coming to Guam who have not yet received their lab results, because again, a lot of the state health local county departments are overwhelmed, and so the turnaround time for their test results is taking longer than normal, maybe 5 to 7 days. And so there are individuals who are coming to Guam, be it for essential work purposes, for hardship, medical, that we are trying to be compassionate about it and trying to do a balance of allowing them out for their essential or hardship purposes or medical purposes, while also trying to make sure we're monitoring them for any signs or symptoms.
Annette, we have a great question here on our Facebook live feed from Karen. Can you tell us more about the degree of community spreading of COVID on Guam? And that's just right up your alley.
I'm sorry, can you repeat the question?
Can you tell us more about the degree of community spread of COVID on Guam?
We did see a slight increase around latter part of June, and a lot of it was based on case investigation, contact tracing. We were hearing a lot of stories of, we had Father's Day gatherings, family gatherings, barbecue. We went to the park or the beach. We've been fortunate that we've seen a steady decrease in those cases of local transmission, and it's mainly been through travel, people being tested through quarantine, that they had recent travel from the U.S. mainland, and that they were coming to Guam either as a returning resident or they're coming for again, hardship or for work purposes. And again, we do test anyone who has signs or symptoms, or if they're in contact with a confirmed case. And so, and the last positive we had was, one of the last positive we had was due to a household contact of a confirmed case.
Where are we
But
with the contact tracing over with GPD? You know, we've been on leave and we just got back, but the last we had heard was that there was an officer, I believe, that tested positive over at the Dededo precinct, and that was about it. And I'm wondering, do you have any updates on the contact tracing process there?
we actually have completed that contact tracing through the support of our point of contacts at GPD. We were able to test other individuals within that precinct, and we were fortunate that no one else became positive. And again, GPD, as well as everyone else in the community, our businesses and other GovBomb, you yourself are promoting about safety measures, social distancing, wearing the mask. And so again, that's really shown to help this community effort of wearing masks and washing your hands, as Dr. Shea mentioned, washing your hands, wearing your mask to help prevent further spread. And so we've been fortunate that contact tracing ended successfully, and there were no additional cases in regards to fellow officers that were in close contact.
Mm-hmm. Okay, and what about the quarantine, government quarantine facilities? One thing I've noticed in the SIT reports is that there seems to be an increase in individuals that have been testing positive in these quarantine facilities. Are they coming in and exhibiting signs and then being tested for COVID-19, or is this through some sort of through contact with somebody who had COVID and like if they were family members or in the same room?
It's actually a majority are asymptomatic. Mm-hmm. We did have a few cases where they were showing signs and symptoms, and so they were tested, and then they were found to be positive. For the majority that are asymptomatic, they were testing as part of our test out process. Of in the past, it was you had to stay at least 10 to 14 days. Now we're again July 24th updates and changes where they're trying to test out 7 days out of the government quarantine facility in order to continue at home or self quarantine. And so that's how again it's labor intensive. It's a lot of work. Yes, there's concerns about cost, but can you imagine the magnitude if we just let these individuals go home? Mm-hmm. Then we find out they're positive, and they've been going around, to different establishments and businesses on island, family and friends. That would make it much more complicated to do contact tracing and to determine if there are more cases that come up because these people were not quarantined and then tested before they were released.
Mm-hmm. No, I was just going to ask, these cases, are they from one particular government quarantine facility or just... Because I don't even know where all of the government quarantine facilities are. We keep hearing about the nightmare at the Wyndham Garden, but I'm not sure where all the other quarantine hotels are.
Yeah, the government is running 3 different quarantine facilities. Yes, Wyndham is one of them. Then we have Ocean View and the Bayview. Mm-hmm. And so, again, we just put it as quarantine facility when they're being the specimens are being delivered to our lab for testing, and our biggest concern is where did they come from? And again, the majority has definitely been the past few cases that have tested from quarantine have come from the continental U.S., and then we did have recent ones coming from Hawaii.
That tested positive. Right. Okay. Are they saying at one particular government quarantine facility that they're testing positive at, or?
No, they say different quarantine.
I see. Mm-hmm. And
they say they're different, but then if they test positive, they move them to our isolation facility.
Mm-hmm. But that's 7 days out of the to test out, right? So,
correct.
And they're asymptomatic. So who's to say?
If they did not have their a negative PCR test less than 5 days prior to coming to Guam, and again, the designation is the non-low risk area and the high risk areas. And so, as Dr. Shea mentioned, there is that algorithm that we look at, the flow chart to help guide us. And definitely the factor is, did you have a PCR negative result less than 5 days prior to your arrival on Guam? And those things will determine whether you go government facility or you can go home or self-quarantine.
Right, yep. Annette, is public health overwhelmed with the contact tracing, or in your opinion, are they handling it swiftly? How many contact tracers do we have? Are we trying to hire more? Just a status on that?
Yes, yes, and yes, sir. We have the ability to scale up and scale down within our department for case investigators slash contact tracers. Case investigators can do both roles, and so we are fortunate that we have experienced staff across from other public health communicable disease programs. We are in the process of hiring additional staff, and that's thanks through the COVID funding related grant we received, and so that is already in the works. People have been submitting their applications, and we've been reviewing that, and the Department of Administration, HR, is assisting us in that matter since we are a line agency. And again, so as soon as we receive a positive case, our team is notified immediately. And again, I take care of the contact tracing side, but we have another team on the isolation unit team that will handle notifying these individuals and also arranging if there needs to be transport, be it from like the quarantine facility to the isolation facility.
Have any of the contact tracers tested positive for COVID? Just curious.
For our staff?
Yeah.
No.
Okay.
No, ma'am.
And then under quarantine, are people under quarantine, home quarantine, obviously, or just any quarantine? Are they being sufficiently monitored, or are they escaping and spreading the disease? Because I heard something, and I don't know if you can confirm this, Annette. It sounds kind of crazy, but I heard that there was a guy who escaped from quarantine. He was like a federal contractor or something.
I can't confirm or deny that, sir.
Oh,
There are individuals.
That means it's true.
I did not say that, sir. In regards to your first question of monitoring individuals at home or self-quarantine, yes. We have our quarantine unit, and we actually have a team that does active monitoring where they do phone calls twice a day, morning and afternoon checks. And if individuals are not responding to these mandated calls, then we do have another team that does compliance visits as needed, that they will literally go to the home or to the rental or a location to check on these individuals who are in quarantine.
So how many cases have we had any exposure, any positives that resulted from people not following the quarantine procedures?
No, sir. The ones who have come up, and again, it's they're the highest risk is household contacts, and they were already exposed, and in contact prior to the known case testing positive. So we've had some where, majority in the household were positive, but again, they were being exposed prior to an individual knowing they were positive. After the positive case has been isolated and removed, we've not seen what we see, as we would say, the next generation of contacts being exposed. No, sir.
I had a question here on our Facebook Live feed. How do you assist homebound patients that cannot get to any testing facility, especially if the patient needs COVID clearance for home nursing care? What would your...
We do provide wraparound services, and so we do have social workers that are part of this COVID response, and there would be a coordinated effort, and so that would be something that ask the individual to reach out to us so that we can try and coordinate having this arrangements for testing.
But do you guys have any clusters that you guys are looking into? Did you guys ever close out what was the church cluster?
Iglesia de Cristo.
Yeah.
Yep.
Was that closed out?
Yes, that was closed out months ago, yes.
Okay. Any other clusters that you guys are looking into?
It was more, again, like I mentioned earlier, due to like family gatherings where we had one or two households. We had went and visited my dad for Father's Day. We had a family barbecue. We went, and so those were, we saw 2 to 3 different households, but we found the link back that they had a get together for Father's Day, or they went to the beach to hang out. Yeah. And so it came from 2 or 3 different households. We interviewed and we tested their respective household close contacts. And so right now what we've been mainly dealing with is those individuals in quarantine coming from off island.
And that's so, again, you're talking family gatherings, and the guidance is when you're gathering with people who are not from your household, even if they're your relatives, you're supposed to wear your mask, correct?
Yes, definitely. And that's something, again, we can't emphasize enough. Face covering, wear your mask, frequent hand washing, don't touch your face unless your hands are clean. Because again, you never know. And unfortunately, we've seen a lot of cases that are asymptomatic And just because we're family or friends, you don't know who you've been exposed to, be it at work or if you went to another function or gathering. And so we definitely want to emphasize, and the order right now is 50 people or less.
Right.
And so again, it's a community personal responsibility. The government, the news media can only do so much to inform and educate, but it is truly everyone's responsibility to help us, prevent the further spread and to follow the mandates. And it's for a valid reason. So we don't see a resurgence of cases in our community.
Can you talk about, the SIT report? It provides the demographics for the COVID cases. And, we're getting ready to start school. And I want to just clear this up. Are we seeing an increase in children testing positive for COVID?
Yes. A couple of weeks ago, we were seeing more cases. And again, these were because they were household members or they were members who traveled with someone who turned around to be positive in quarantine. And that is something that's also being noticed in the mainland as well, that more children are becoming positive. And again, that is something that this disease does not discriminate: age, race, ethnicity, income, occupation. And so that's something that, again, everyone should take the necessary precautions.
Going back to the gatherings that led to the positive cases. So in your contact trace investigation, when we had that Father's Day gathering and different households were together, was the spread and due to people not wearing the mask? Were you able to determine that from your investigation? I mean,
yes, we did. And we thank the people of Guam for being very cooperative with our investigators. Because it's based on their information where we determine who else are contacts, where have they been, and who else do we need to notify about possible exposure and to do interview. And so in our course of investigation, various cases did mention their gatherings, even if it was less than 25 people. Some people wore masks, some people didn't. Other incidents where everyone wore masks, but again, that's based on their recollection or from what they can see. And again, so we're hearing a mix of both wearing and not wearing. There were more than 25 people, less than 25 people. And at the time, that was what was being ordered, of no gatherings more than 25 people.
Right. And we are believers in the mask. I don't know how the mask got politicized, but, we're wearing them. I don't live with Sabrina, so, and we're here. And I know that the executive order mandates that we use the mask when we're in public. And even though we're in a private business, I just use it whenever I leave my house. And I'm a firm believer that it is one of the ways that we have really dodged a bullet. And it's funny because it's almost like a chicken and egg thing. I hear some of my friends talking about like, why should we wear a mask when, the big second wave that Dr. Doomsday predicted never came. And I'm like, well, maybe it never came because we've been doing so good. Mm-hmm. We've been in the quarantine. We've been, social distancing. I mean, I don't know. I think we deserve a little credit out here, Annette.
Yes,
not
definitely.
Us, I mean the people, right?
No, everyone, and again, media does their part, and we thank you for always emphasizing that, because it's true. The people of Guam have been very cooperative in wearing the face mask, and that's why, like you mentioned, we're seeing this where we're still kind of relatively low compared to like the mainland, where people are refusing to wear masks, and we've seen this huge resurgence in their cases, and as well as the hospital beds are already full to capacity, and so they're trying to beat back on this resurgence that it's actually for some states worse than the first time that they've had cases. So again, yes, it's definitely a community effort, and we appreciate everything, especially for KOM. I see your advertisement out there about please wear your face coverings or your mask, because that is one of the biggest preventive measures. And again, it's public health can't do it alone. The government can't do it alone. It's a community-wide effort, and we need to continue to do this until, unfortunately, there is a medication to prevent it or the vaccine to prevent it.
Right. Yeah. Well, thank you for that, Annette. We got to run. Is there anything else in closing that you want to put out there for the people listening?
Yes, again, if you have any concerns or questions, so please call us. If you hear any information, please make sure it's from a valid, reliable source. We've had numerous instances of rumors going around, and we don't want to cause undue panic. Public health is here doing their job, and as quickly and as to the best of our ability. And again, it is the community effort, public private military and for our general public. Please wear your mask, stay safe, cover your cough, and wash your hands frequently.
You got to say it like, wash your hands.
Wash your hands.
Yeah, just
All
like
right.
that.
Thanks a lot, Annette. Stay safe.
Thank you, Annette. Wash your
Thank
hands.
you.
All right.
Thank you. Bye-bye.
Bye.
Oh, man. You know, I got to give Annette props. It's classified employees like Annette who, you know, are out there doing their job. You know, they're not political. They're not getting a lot of glory. But those are the people who hold this government, who have been holding this government together. So thank you so much. And you guys heard it there. Wear the masks. I mean,
And we've got a bunch of public service announcements that Public Health has produced that we're going to be rolling out in the next few days if we haven't already. But I know that they have produced a bunch of videos.